I'm Dr. Heath Hendrickson from Dr. Wisdom Teeth, and in this video we're going to talk about dry sockets and what you can do to decrease your chances of having one after your surgery. Dry sockets are probably the most dreaded experience for people anticipating wisdom teeth removal. They have a terrible reputation, but as the doctor, I want to tell you, to be honest, don't worry about a dry socket. It actually happens rarely. In fact, it only happens in about 1 to 15% of extractions. If you'll follow the directions in this video, you'll be doing all you can to get yourself down as close to 1% as possible. So what is a dry socket? The causes of dry socket are not well understood, and numerous studies have been done to better understand dry sockets and what caused them. Even among dental professionals, many concepts about the condition are controversial. So here are some things that we do know. Symptoms of a dry socket typically develop 4 to 5 days following surgery and are characterized by an increase in pain radiating to the ear and the side of the face. By day 4 or 5 after surgery, typically pain is decreasing every day, so an increase in pain at this time can be a sign of dry socket. If ibuprofen and Tylenol taken appropriately do not decrease the pain, then a dry socket would be suspected. Generally, dry sockets will go away on their own with time, but most patients don't want to wait around in pain for the body to do this, for the body to resolve the problem. So you may receive treatment for the pain of dry socket at the doctor's office, while the body goes on to resolve the actual dry socket. In our office, we've developed the following suggestions to help our patients avoid dry socket during their recovery. Follow a liquid diet for the first 48 hours. Why is diet important? By eating a liquid diet, or maybe we should even say drinking a diet, we're trying to keep food particles from being packed into the sockets of the lower wisdom teeth, where most dry sockets occur. We commonly rinse large amounts of food debris from the extraction sites of patients who experience a dry socket. Food debris could serve as a food source for increased numbers of bacteria that can cause problems with healing. It is also thought that food debris can cause the protective blood clot in the socket to be displaced, exposing the bone of the socket to bacteria and open the patient up to localized infection or a dry socket. Starting on day 2, use a Monoject syringe provided by your doctor to gently rinse the lower sockets with tap water 4 times a day, after breakfast, lunch, dinner, and before bedtime. Rinse the sockets by placing the tip of the syringe to the back side of the second molar, in or above the tooth socket. Lightly irrigate the socket 4 times a day, but don't overdo it. Be gentle. We aren't power washing the sockets, just lightly rinsing out any debris that might have accumulated there. And finally, don't smoke. Smoking causes a decrease in blood flow to the surgical site and thus challenges the body's immune system to heal the extraction site properly. Dry sockets are very common in smokers. Oftentimes patients ask about vaping. There are very few, if any, studies done on vaping and dry sockets, so typically I will tell my patients to avoid vaping. But if you do vape, be sure you are using a non-nicotine product. It's the nicotine that is the primary concern. To minimize your chance of dry socket, do your best to follow the instructions in this video regarding diet and extraction socket rinsing and smoking. If after day 3 or 4 following surgery, pain dramatically increases at the extraction site, radiates to the ear, head, or neck, and will not respond to ibuprofen or Tylenol, call your doctor's office for help. Treatment of dry socket in the doctor's office is relatively painless and will give you tremendous relief.